Hello, this is Dr. Sarah Gomendi with Vibrant National Medicine, and today I want to talk about optimal testing for thyroid health. So I have a lot of people that come into my office with hypothyroid symptoms, and they'll tell me that their thyroid has been tested in the past and they were told that everything was normal. However, upon further assessment of those lab results, oftentimes the only thing that was measured is a marker called TSH. And that alone is just not sufficient enough to really assess what's going on from a functional medicine standpoint with thyroid health. We really need to look at several different markers so we can see what's going on. I kind of talk about it or explain it that like TSH is just a snapshot of a picture, and we really need to be able to see that whole full picture and all of those pieces, kind of like a puzzle. We need to see all of those pieces so that we can put the puzzle together and really be able to assess what's going on. So when you are looking at thyroid lab markers and assessing those values, you need to also consider the reference ranges. So the standard reference ranges are really wide. So for example, with TSH, the standard reference range goes typically from about 0.5 all the way up to 5.0. And oftentimes if people aren't outside of that range, say at 6 or 7, a lot of times they'll be told that their thyroid's normal and their chronic fatigue, their constipation, their other hypothyroid symptoms have nothing to do with their thyroid. Yet typically what we tend to see clinically is that people usually feel their best when their TSH is between about 1 to 2. And like I mentioned, though, it's not just about TSH. So you may have even what we consider a normal TSH and T4 value, but we do have to turn T4 into T3, and then we need to assess how much free available T3 the cells can use. So that's what our cells can actually use. So if you are converting down into maybe something called reverse T3 instead of the available free T3, even if you have a normal TSH to T4, a lot of times you may still have those hypothyroid symptoms. So again, it's important to look at that whole picture and do a panel where we can really see what's going on. The other thing I really recommend looking at when you're testing for thyroid health would be the antibodies. So there's something called thyroid peroxidase or TPO, and that is an antibody that assesses for the autoimmune condition Hashimoto's. And Hashimoto's is the most common cause for hypothyroid symptoms and conditions. So it's really important to assess this, that we know if that's part of the root cause of what's going on, and if so, then we need to work on the immune system balance as well. This also comes back to play when we're looking at natural treatments for thyroid health. There are a number of supplements and nutrients like iodine and tyrosine that we would not want to take if you do have Hashimoto's or those positive antibodies. It's kind of like throwing fuel on the fire, and it can actually make everything worse. So I found that a lot of standard thyroid testing methods that are done are just not optimal, and oftentimes they leave many people continuing to suffer with these symptoms and no answers. So if you have either never had your thyroid health assessed, or maybe you've only had TSH measured, if you have any of these hypothyroid symptoms, then let's go ahead and get a full panel of markers tested on you so we can really see what's going on and get you the best recommendation.